PCOS or polycystic ovarian syndrome is a term we hear very commonly in recent times. So what is PCOS? Many a times, many distraught parents come to me with young girls saying she's got cysts in the ovaries. Is it something to be scared about? So I thought I'll say a few words on what is PCOS. See, cysts in the ovaries can be quite a normal physiological thing. If the cysts are less than 5 centimeters in length, they will go in a different cycle, so you don't really need to worry about it. PCOS or polycystic ovarian syndrome is a group of symptoms which define this term PCOS. So what are they? Normally you have girls complaining of delayed irregular menstruation. They may or may not be overweight or obese, acne, excessive hair growth called hirsutism, hair loss from the scalp. These are some of the various features which the girl can present with, but not necessarily all of them have all the features. So who do we stamp, which girls do we stamp with the word PCOS? Anybody who has cysts in the ovaries? No. Because as I said, one can have a condition called multiple cysts or multiple cystic ovaries and not be PCOS. So what I feel is PCOS can be defined by any of the three things I'm just now going to mention. The clinical symptoms which I just talked about, the clinical signs, acne, excessive hair growth, hair loss. Number 2, ultrasound diagnosis of multiple cysts in the ovaries, which has a particular arrangement. They're arranged like a garland on the surface of the ovaries, and they're small in size. And third would be the laboratory diagnosis or the hormonal profile. So out of these three things, at least 2 should be positive. Another point I would like to mention is PCOS is basically an inherent or an inborn problem to produce a particular female hormone in adequate amounts. And because of this, there is a hormone disbalance and male hormone-like effects predominate. So you have these male hormone-like effects of oily skin, acne, hirsutism, etc. Now, any young girl can have hormone disbalance, like from the time she starts menstruating, say about 14 or 15. Initial period of her years, she might have hormone disbalance. She might even have cysts in the ovaries, but this does not necessarily make her a person with PCOS, because you have to understand that total sexual and gynecological maturity can only happen after a few more years, around 22, 23 years of age. So if after this all these conditions persist, you can be assured this is going to be present for the rest of your life. Now why I'm stressing on this point is because then you will have to understand that medicines cannot cure PCOS. It can only control it. If these conditions persist after 23 years of age, you can expect medicines to control the problems but never cure it. So don't expect miracles from the doctor, the 6 months of therapy and she'll be cured. No. But I would just now like to talk a little bit about what are the expectations, what are the objectives of treatment. See, when we are treating PCOS, my counseling is generally like if the body recovers on its own by 22, 23, you have nothing to fear. If after that the problem still persists, it's not like it's going to be a life-threatening problem, but certain adjustments have to be made. Because there is a hormonal disturbance, ovulation is not taking place, obviously there is a problem in conceiving. So these patients will need a special sort of treatment, special medicines to help to ovulate and to conceive. But the good part is they do conceive and it is successful, the treatment over here. So there's nothing to worry that if you have PCOS you cannot conceive. You will simply require treatment from the doctor. Regarding acne, hirsutism, etc., very good therapy is there. But other than medicines, please do understand, if you are overweight, losing weight by diet and exercise is equally important as the medicines you've been prescribed. So do not treat it lightly if the doctor tells you that you have to lose weight, because we have seen that there is a direct relationship with this ovarian cyst and weight gain. Sometimes excessive weight itself can cause cysts in the ovaries. So simply by losing that extra 10 kilos, those extra 10 kilos, you might realize that you don't have cysts in your ovaries anymore. Of course, these are not true PCOS. So, in summary, let me tell you, PCOS has a genetic predisposition, that means it has a tendency to run in families. Number two, if it is persisting after 22, 23, medicines can control it, not cure it. Remember, weight loss is a very important part of the management. And lastly, PCOS is not the end of the world. It's a very common problem which we are diagnosing nowadays. You simply have to make some lifestyle modification changes, and otherwise you can have a perfectly normal life. Thank you.